Thank you for taking the time today to attend the ASHE Lunch and Learn webinar, Breaking the Mold, a Better FCA for Healthcare Facilities. Our speakers today are Travis Epperson from ImpactDM and Josh Lowe from AkitaBox. Travis has 28 years in commercial construction, of which 24 years has been exclusively in healthcare. He's split those years working for a large commercial general contractor and leading the construction department for a large healthcare developer. Travis has managed projects with multiple health systems in the Southeast, including Piedmont Healthcare, Wellstar Health Systems, and Children's Healthcare of Atlanta, just to mention a few. Josh is co-founder and chief solutions engineer for AkitaBox with more than 15 years of experience in the facility management industry. He's passionate about helping AEC firms, building owners, and facility management professionals make data-driven decisions that impact operational efficiency and success. So with that, I'll turn the microphone over to Josh and Travis.
Thanks, Beth.
Yeah, happy Thursday, everybody. What we want to talk to you about today is, facility condition assessment and capital planning, which I know that if you've been in facility management a while or planning budgets, that is an important thing to do. And so in order to show you this, we felt like we could do a case study of sorts of a project that Josh and I worked on with also other team members at the end of last year. And so we're going to work through, what the need, the challenge, and the goal was of the effort, as well as how we defined the strategy for this to be successful, how we went about selecting the right software platform and partner, the approach of how we captured everything and delivered, and how we made inventory of everything, and then how it works in a manipulable format. If you go to the next slide. Okay, so this project that we did, meeting with hospital leadership, what they needed was an accurate and detailed facility assessment of their health system assets and a prioritized capital cost projection for the next 10 years. The challenge of this was that, as most hospital facilities, it's multi-generational expansions that have happened, some acquisition of properties, and we needed to put a little bit more focus through a healthcare lens in comparison to a typical, the way ASTM defines property condition assessment. So the goal of what we were doing was to end up at the end of the work with a comprehensive assessment of the real estate assets, including exterior, site work, structural, building envelope, the MEP systems, the state of the interior finishes of the facilities, and a detailed and accurate capital plan and projection for the next 10 years. But we also wanted to do that in a manageable format that could be inputted and updated in live fashion. So the way that typical facility, in history, where facility condition assessments have been done, there's challenges associated with them. There's unreliable asset information. Who was the one who looked at it? Can I define what I'm reading in this condition assessment? Multiple data sources and spreadsheets. You may do a condition assessment of a facility and then 3 years later pull it off the shelf and try and figure out, okay, who made opinion of this, and have we made alterations to our facility since that opinion was been made? Inaccurate capital cost projections. Incomplete asset data. Did we capture everything that's going to be associated with capital cost? The reports that you generate tend to be static in nature. How many times have you said, okay, what is this year's capital plan that may have been done 10 years ago? Have we done some of these things previously? So it's static. And then lack of healthcare focus. Facility condition assessment can be performed the same way on a movie theater as it is a hospital or as could be a retail center. But not having healthcare focus has been a challenge in the past with facility condition assessments. The outcomes of previous work, the way things are done, that had been done, poor capital planning, spoiled, outdated data. The data cannot be manipulated down to the asset, down to that, boiler pump, or down to that, the furniture finishes in one room. Costs are hard to assign, and these usually are managed based on a static schedule. In the past, you would take, okay, this year's capital plan includes this. That's static. It can't be moved or shifted. And that all ends up being an increased risk of emergency spending. Either, no one wants to project capital too conservatively and run the risk of not being able to spend dollars on healthcare services, or, too lightly where we have emergency spending and we're going over our capital improvement budgets. So the facility that we want to focus on is in Atlanta, Georgia. So this is our impromptu case study, I guess you could say. So it was made up of running and functioning hospital, children's hospital, 750,000 square feet, we'll say, a medical office building, which was an acquired asset on that campus, as well as multiple generations of parking deck. Also, there were 3 outlying outpatient centers, one being an ambulatory surgery center and 2 being standalone urgent care centers, to give you an idea of what we were trying to create our capital plan and facility condition for. So we defined strategies for success of this project. We wanted the capital plan to be in a live, manageable format. So we knew it had to be software, live, with user interface driven. We needed to assemble the right team to do this work, and we needed to capture the right assets. With a team, you have multiple eyes looking at some of the same things. They may be grading things differently. Okay, so we need to establish a clear grading process. We wanted to ensure that we included folks who had worked in the facility to maintain it. And we wanted to make sure that we were not missing out on things that may have been past legal areas for risk. So it's starting with, how do we find what we thought may be, a pink elephant, which is a software platform that could do all the things that we were trying to do. So through a lot of work and research, we found AkitaBox. And so as we researched AkitaBox, interviewed them, and worked through the product that they had, it was checking all the boxes that we needed for software platform. Manageable cost data, we could project, we had live user interface. So if you go past to the next slide, please. Yep. So we knew that being a data platform, it could be a single source of truth for facility budget analysis and decisions. Platform to maintain the capital plan in the future, and aggregate additional data sources to improve capital budgeting. All that means is that, we wanted to, this platform was going to, as we made changes, as we may have moved something up in a cost expenditure or moved something back in a cost expenditure, or if we had done some renovations within the 10 years, it could be changed within the platform and still be current and accurate. So we needed, as we assembled the experts. So this project, we talked about exteriors, civil, structural, architectural, mechanical, electrical, plumbing, conveying systems. We wanted to, we wanted to look at elevators to make sure that they were in good shape and what may be spent in the next 10 years. And of course, building envelope, which we have all dealt with, that being an expenditure that might not have been foreseen. Capturing the right assets. We worked hard with the facility department of the health system to make sure that we were analyzing and providing capital plan for the right assets. Okay, so as we did that, so that each of the sub-consultants that were making opinions on current state were analyzing the right facilities. Now, capturing the right assets, if you can think about upwards of 1 million square feet and having to take multiple sub-consultants that were working on different things, building envelope, MEP systems, architectural, and you can't just say, okay, let's all open the doors and walk through this existing hospital. One of the great things about AkitaBox and the way that their program works is we were able to collect assets for them to use. And so Josh is going to tell you about how his team inventoried what was within the walls and the exteriors of the facilities that we were analyzing.
Yeah, absolutely. And, thanks, Travis, for taking the time to walk us through the problem here that we tried to solve. When Travis called us, it was a no-brainer for us to jump in and help, especially when he started talking about how the need for getting the multidisciplines, they weren't all working for the same company. How do you send all these folks out to the field to collect this? And we've had some experience with this before. And so as opposed to go through a couple slides here, I'm going to take 1 minute and hop out of the slide deck, and I'm going to share my other screen with you just to give you a visual of how that data was actually collected in the field. And so if you should be seeing my screen right now, and you can see that the way that we wanted to do this, because one of the big things that we were also concerned about in this process was you're now not just sending one firm out into the field, you're sending multidisciplines, which was a great strategy from the get-go, because the HVAC and plumbing and electrical contractors that were involved were that healthcare system's trusted advisors, right? In some cases, the HVAC folks had done more work in that hospital than anybody who actually worked in that hospital. And so they were the perfect partner to do this, but we had a data collection problem and a transparency problem. And so how do we send folks out to get data and then bring this all back and in a relative short fashion, turn all of that good input and data from the folks who know the facility the best and can highlight the risk and start to hand that off so that Travis and his team can put the healthcare lens on top of it. Collecting the data became part of the issue. And so we're looking at this now, as opposed to collecting in a form view or list, we're actually collecting in plan view. And so you can start to see here in plan view that we have all of these different types. And you can see over here that this is where, depending on what I was tasked with collecting in the field based upon my discipline and my expertise, I could filter down to those. I could add in that data. As we turn this data on and off, we can see, again, bringing that transparency. Well, where did that data point come from? And why did we say that it was in excellent condition? Well, here's all the photos associated and where it was on the plan. Somebody could go back and to Travis's point earlier, being able to make this a living database moving forward for capital planning. You needed a way to go back and quickly audit it and provide that transparency so that you did know that got moved up, or that condition changed, or we did do that capital project, so that we can make sure that this is maintaining itself and keeping the relevance moving forward. But, you know, what we did initially as well is we sent a single team into the field. And it was, you know, in this case, it happened to be AkitaBox folks that went out and collected this data, but we did a baseline. So it was just the asset inventory mapping program, really. So it was going out, it was identifying them, it was putting a QR code on the asset, it was taking all the photos, and it was getting that prepped so that as the other folks coming in started to interact with the data, a lot of the baselining was there. And so it was really a matter of that mechanical team or that electrical team could now free flow through the facility and find those assets and scan the QR code and update the data and update the condition using their expertise and their knowledge of the facility. But the baseline was there. And so the platform was really providing that transparency in the process to get us to the point of putting, you know, linking this to the cost data and linking this to the life cycle data and making sure that we know, you know, what condition, when was it installed, when is it expected to be taken out. All of that data can be connected in a single platform, and all of that expertise coming from all of those different stakeholders in this plan can converge into a single platform to provide that value. Travis, anything there that I missed in that you wanted to make sure that we highlighted here?
No, because I think that we cover this when we can outline step 1, step 2, step 3, step 4. But step 1 was collecting the data and importing it into Plan View so that subconsultants could be efficient. And you may have some of that, yeah. So you can see this is how, you know, the AkitaBox team went through all these facilities. And if you notice in that photo on the right, you've got an asset sticker or barcode that as the asset collector was going through, I mean, they had a roll of stickers. I mean, they're marking everything from fire alarm device to fire extinguisher cabinet to boiler to emergency generator, so that, and it was pretty neat because you could see, if you were watching it live, you could see a floor plan and you could just see dots start and you could see what they were collecting, because it was just an easy thing to be able to hand to, whether it be TLC doing the MEP condition assessment or exteriors. They did LiDAR of exterior building sides, you know, whether it be the building envelope folks, and they can, with an iPad, be able to make the notes as they were going around and making a condition assessment of each asset.
Yeah, absolutely. And one of the things that we got to discussing as part of this project was, you know, the concept of a digital twin and what were we really doing out there? And was this a digital twin? Wasn't a digital twin? And I think it's worth at least having a brief conversation or highlighting the fact that, you know, I think that the architecture and construction industry, who led the charge in the digital twin kind of development and value, have really created these high value for construction and architecture digital twins. And that's great because there's a lot of value when you're building a new building. But going back and retroactively creating, you know, construction level digital twins is never really financially feasible, and the value is never really there. So you don't get the ROI. So how do we bridge that gap from our new buildings that maybe we have a digital twin or Revit, and what in most cases is the majority of our buildings that don't. And so that's where we're starting to kind of change the narrative here and talk about digital twins, not as a finite, not as an LOD, but really as a spectrum of how your data can be organized. And it really starts with structured data based upon location. So, you know, it's building level, floor, room, and making sure that we know where those things are and can locate them. But it's at least worth the conversation, just because I think digital twin gets thrown around a lot. There's high expectations around it, and it's at least worth knowing that it doesn't have to be complicated and overly complex. It can be as simple as data points on a map.
One thing I want to point out, you know, while we're talking about data collection, and we've got a lot more to discuss, but there may be some folks on this call that are thinking, I don't have all of my drawings electronically. I got some electronically, I got some that are rolled up blue lines in a closet. Okay, that's just reality. Now, what was good about this is we started off with a Revit model of what the facility was that we thought. And we did have some areas that we knew ahead of time were black holes that we did not have digitally. So the AkitaBox team, as they were going through collecting assets, were also confirming that the wall locations and the layout representation that they had digitally was correct. Mm-hmm. If it wasn't, they made changes or filled in the blanks where it wasn't there. So
great
if you're concerned about that, we were able to solve that through the asset collection. I mean, you take a 750,000 square foot facility, even if you manage that facility, I mean, you cannot get to every room to ensure that those walls and door locations are right. And we were doing it anyway. Let's go ahead and correct it while we're there. So
yeah, great point. Again, just a couple points here and making sure that we're covering these right. Like, we could track the progress. We knew what percentage of things were done and where data was filled in and what gaps we still had in the process to make sure we were following up with the right things because of that visibility and transparency from the get-go. We were simplifying the process. We were putting everybody in the same system with, minimal training. They're off into the races by scanning QR codes and updating data. This is meant to be a simple process. And so the goal here was simplicity and making sure that, everybody could partake in this process. And then ultimately it all goes back to reporting that work. Where's the data go? And so by using a standardized process and a standardized tool with predefined drop downs, and Travis talked about it, and he'll talk about more here coming up, the grading system and the healthcare lens, but by putting some of those things on and forcing how that data is collected, it really led to the ease in pushing out the reports on the back end.
Yeah, and so think about a typical facility condition assessment, right? I mean, there are firms that will do it soup to nuts all the way through. I'm going to tell you about your structure. I'm going to tell you about MEP, building envelope, all that as one firm. Well, our strategy was to use multiple firms that were focused on those disciplines because we needed cost input on repair of those items that we trusted, right? And some of those we reached out to contractor community to get more realistic values because a lot of decisions were being made on that. So when you have multiple disciplines looking at your asset at different areas, you got to work together as a team to establish the clear grading, right? I mean, someone may say immediate critical priority one item is a broken curb and gutter. Well, that may not necessarily be a priority one item in the eyes of the health system. An aging boiler at the end of its lifetime may be the more priority one. So working through that as a team, we made sure that each one of the folks that were doing a condition assessment were looking at them at the same priority thought, okay? Because that's key, because you run the risk if you don't do that of receiving multiple published reports and you can't trust that someone else's immediate priority means the same as others. So it was a real collaborative effort and teamwork. So that was helpful. Other thing, as Josh touched on a bit, was every one of these facilities has folks who work in them, maintaining them every day. A lot of times those are subcontracted specialists, right? Typically in the MEP world, but almost always in the elevator world, right? So prior to our sub-consultants going out in the field, we interviewed the trusted folks that work in that hospital every day to kind of see where we need to look. Don't miss this, right? Because that was important that we'd run the risk of getting done publishing a report and then having someone who works in the hospital every day and go, oh, you didn't know that, the valve on air handling unit number 7 sticks, so that was important to do as well. And then if you go to the next slide, I touched on it a bit ago, but we'd be doing a disservice if we went out in the field to do condition assessment without knowing historically, has there been any incident reports? Has there been complaints from patients and family members about, I don't know, some expansion joint cover or something like that? Because these are human beings, and we don't want to run the risk of missing something that had been a past complaint. This is, what I was referring to earlier when Josh was talking. We tried to put together something that kind of showed you the steps that we went through to ensure that we came out at the back end of this with a real, thorough, thought through, with owner input report and capital plan. So AkitaBox team went out in the field and used the Revit models provided, filled in the blanks, collected assets that we had defined previously, put them in a digital format. Okay. We've assembled this team of sub-consultants. They haven't inspected anything yet. We had interviews with trusted maintenance folks so that those sub-consultants would know, where to look or where to not miss, let's say, in addition to their normal assessment. They use the AkitaBox platform to insert, and Josh will show you in a minute, some of the opinions, potential photographs, model numbers, years to date, useful life cycle of a certain product within the AkitaBox platform. Then, in addition to entering in that data into the software format, each one of the sub-consultants did a normal published condition report that we're used to, a bound paper. It's PDF now, but they did that. So we as Impact received all of those, one for elevators, one for building envelope, one for site, one for structural, one for architectural, and all that. We analyzed them to ensure that a couple of things. Were they prioritizing the same? Mostly were. Did the values that they provided for repair of any found item make sense? From a location standpoint within the hospital, something next to an open heart surgery, it cost more to repair than something that's sitting on the roof, right? Then, we made comments on their reports. They went back and made the changes in those comments. And then we reviewed all of this with the facilities department that asked us to do this with the health system. In addition to that, so we were able to publish, here's what we're going to give you in a published static format. We also did the platform delivery where we walked them through how we inputted all of the data, how to use it, do the training, how to manipulate it, if costs increased or decreased, or if you did something sooner or later. So there was a month or so of training that we did with them so that each one of their, users knew how to manipulate the system and manage within it.
Yep.
So Josh is going to talk to us and kind of show you what is this live database, and some of the things that it can show you. And it's pretty amazing stuff.
Yeah, absolutely. And, again, this is a spot where it's best to, as opposed to look at static screens, actually hop in. So let me stop this here and reshare my screen. I'm actually going to go into our capital management piece here. And so it's worth talking about. Actually, before I go in here, I'm going to start here. I started to highlight things like the assembly life cycle and the input from the experts who were out looking at this in terms of what the expected life cycle was and all of those things. The other thing that happened here as well is that in the system, it got connected to RS means. And so if I go in here and click on this itself, it's going to take me into the capital management module where I can start to dig into the data specifically at an asset level. And so again, this goes to the transparency of, defensibility, right? When you start to get questioned of here's what we're asking for and here's why, being able to know, right? And in this case, this is a low risk item, simply because of the fact that, the severity of failure and the condition at this point, the combination of those make it a low risk. We can start to look at it in terms of what's its cost. And again, this is connected to RS means, so that as RS means updates into the future, the cost database based upon existing commodity costs, et cetera, this will update in the system. And so going to the idea of that live database, it's important that not only are we giving the ability to update this, manually in terms of, did we do this project yet? Travis gave, an example of moving up an expenditure or pushing something back, but being able to manage that, but just not just that, but also have some automated updates in terms of the RS means base costs in the background. And you can see here that, this one has actually been adjusted above RS means costs because of there wasn't enough there. RS means is good as a baseline, but the experts always know that, it's always 20% low. And so that additional detail can get added on, and that intelligence, or that expert intelligence that RS means is low here, and we need to add a multiplier, will maintain in the system over the life, even though the background data is changing and updating. Again, to that defensibility and having all the data, it's all right here in that one screenshot. Yeah, Travis, go ahead.
Yeah, let me touch on the means cost data, right?
Yeah.
As we did the work at the health system we described here, it was easy enough to capture the replacement of a boiler or generator or re-roofing or something like that. The things that are hard to capture that are capital expenditures are some of the building envelope pieces, right? If I have an exterior building assembly that is brick, okay, it's got caulk on it, it's going to have to be maintained, but how do you do that? So how do you project the value of that? Same thing with exterior metal panel or window systems or parking deck sealants or something like that. So the RS means data was very helpful that way, because we could say, okay, I've got this many square foot of this item, and it could then park a capital cost associated with the maintenance of that. Because if you don't do that, then you end up with, now we got to caulk the exterior of the south side to where the sun hits. No one ever thought we had to do that. Where's the value? Where's my budget for that? So those are some of the things that it was very helpful to fill in the blanks, in addition to what Josh is saying for updating in real time as, inflation or whatever. But that was a big help to us.
Yeah, and here's some examples of not just, the individual, rooftop unit, right, which is here, but now you're also looking at that parking deck, and, there's a projected cost of $2.5 million. And so again, it doesn't have to be just the individual. You can do square footages and budget that out. And so it was the ability to have flexibility in that data set, really to meet Travis and the team's needs to deliver what was necessary here for success for the healthcare system. And then along that line, being able to project some of these things out, like total renewal costs, looking at things like the facility condition index over time, what happens based upon current budgets, and really start to interact with the data. And like I said, being able to shift these things and update them and say if they're complete, or move them forward in time if we need to, again, push something back or move something forward. And so having all of that data in one place to be maintained. And also, again, it's the defensibility and the transparency. So knowing that you can go back in and click on something and find the data behind it was key here. I'm going to stop sharing this and go back to our deck.
Well, one thing, I don't know if you want to do it or not. Some people might be having a thought about, what does that asset collection look like from a facility management side, not just the costs associated with repairs, but when I'm a facility manager and I have an AkitaBox, login or user interface, can I go into a room and immediately go, okay, what's the boiler in that room? And if you've got that, you could just show, and you might go into it later, but if you can just click on one of the assets and show the audience, like, here's some of the things that can be stored in there. I know you talked about pictures, but
Yeah,
would be, I think that would open some eyes on
let me grab one of those here quick.
some of the things that were pretty cool, because, you know, how many times have you said, okay, where's rooftop unit 5? How old is it? When did we change the belts? Well, someone's got to go run over to rooftop unit 5 and see, or, you know, that was very helpful. You were on one earlier on a boiler or something.
Yeah,
So that you can, yeah, I mean, your facilities employee, or, you know, can sit at their workstation and see these things, so that then they can order the replacement filter for that or whatever.
Yeah, I'm pulling up a demo project here that has some more stuff loaded in. And like you said, I mean, even down to the fact of, you know, we have folks interacting, you know, with this stuff ahead of time, and putting the notes in there, like the fact that, hey, you need the 7-foot ladder, there's not one in the room. You know, this is a little bit, it's a fully configurable, you know, data set here. So sky's the limit. We have people that track everything from belt size to quantity to, you know, we talked about replacement priority, tracking warranty, you know, when do warranties expire? Where are all those photos, O&M manuals, warranties? Sky's the limit here in terms of what's available to be stored. And so really, you know, it's the starting point is the inventory. The starting point is moving in the direction of location-based structured data, so that you can start to add to that and associate things, you know, not just in existing buildings, but also how are you getting structured data for your new buildings, and is that sustainable? I think, you know, I'm sitting here in Chicago at a conference, and I keep hearing the, you know, sustainability and ESG, and I think we're very conscious of some of that stuff in terms of, you know, energy, and do I put insulation, or do we want solar panels, or, you know,
Yeah.
but we don't really talk about the sustainability of our data. And I think what Travis and his team really did to bring justice to the healthcare system was that they weren't satisfied with the old way of doing things, and just handing over data that they knew was going to be thrown away again in 3, 5, or 7 years, and really looking towards the sustainability of that data, for the client moving forward, not just for this use, but for other uses. Facilities data, facilities location data is used specifically in healthcare, for a variety of reasons. Square footage, asset counts, asset location. I've been in systems before that they have upwards of, you know, 18 to 28 different pieces of software that use things like square footage and asset counts. And so making sure that we were delivering not just what was needed for the FCA, but, you know, Travis alluded to it a bunch, as long as we're there, why would we not get that? Or why would we not start with the Revit model to have square footage accuracy, you know, across the facility? All of those things kind of fall out of the process when you take the right approach and take that sustainable approach to the data, as opposed to a throwaway approach to the data, which I think the industry, not willingly, but, you know, we've all been a part of the fact that we're turning over data, or have been turning over data on a daily basis that we know isn't going to be sustainable for that client, for the long run.
Yeah, sorry to drop you back into there, but I think that's an important thing to see.
Good point.
And so you've got some things on the deck still, or I know there's questions. I don't know what the plan on that is.
Yeah, I mean, I think, and actually, Travis, that was great, because that really led into, right, that future conversation and the sustainability of the data. And, you know, are you looking at data aggregation platforms? There's a kind of movement right now towards simplifying, and you know, making sure that your data stack, you may still keep and maintain a lot of different data systems, but simplifying the interaction between those data systems. And so they may provide some very specific value, in and of themselves, but why maintain the data in that system if it's hard to maintain the data in that system? and it's coming from, you know, a model or a source of truth somewhere else. And so trying to make sure that we're driving towards those things, because as soon as we do move towards structured data and we do start to make those moves, you know, IoT is out there. You know, there's a thought that, you know, the future is here, and it's a quote that I've heard over and over, but you know, the future is here, it's just unevenly distributed. I think we hear a lot of promise about sensors and what they're going to do for us in our lives, and I think there's a lot of confusion around it. First and foremost, you need to start moving towards structured data so that you can start to take advantage of these things as they come out and you find specific use cases. I don't think anybody's out, you know, advocating that we put sensors on every piece of equipment. We just don't know the values there yet, but how do you start moving towards the opportunity when somebody comes up with a sensor and says, hey, if you put these sensors on these 10 major pieces of equipment, we can save you $500,000 a year. You want to be ready for that. And so, you know, start moving that direction. I think AI and ML, I just threw this slide up there, more so to poke at it a little bit. I think we hear these words a lot, you know, in conversation. If you go to conferences, you know, AI, ML is dropped constantly in terms of, you know, how it's going to help our lives or how software systems are using these. Don't get me wrong, there's a lot of value in these, but most people don't have their data structured in a way to even start taking advantage of this. And so, you know, again, it's great. We all want to strive towards the future and drive that direction, but we also need to start. If we don't start, we're never going to get there. And so, you know, I think, again, it's looking at how do we provide more value to our clients through the things that we're already doing by using different tools and delivering things in different ways. And so we are all driving towards AI and ML, but it starts with good and structured data. And I'll leave it there for some Q&A. I see we have a couple questions down there. Travis, you got anything else to add here before we move on to Q&A?
No, I mean, I was just looking at the questions. I could, you know,
jump on
answer the first one.
Yeah.
Okay, so does your life cycle cost assessment use the manufactured recommended maintenance frequency and cost to identify the likely service life? Well, what we did here was, as we were doing asset collection, we found the model numbers and knew exactly what that equipment was. And we looked at the manufacturer recommended life cycle for replacement, right? So we're like, okay, this boiler is a 20-year boiler, whatever, and we parked a value in there for replacement at that time. Then take a boiler, for example. TLC Engineering was doing the facility condition assessment. They're going to make comment on that specific boiler and provide us with that opinion and that input. If that input was, this thing has been maintained, you know, excellently, and we should expect its life cycle to be much longer, then that way we were able to kind of move that cost value to when it would hit at that time. And same thing, if it was not being maintained well, we're looking to shorten the recommended life cycle of it for the capital projection. I hope that makes sense. On the next question, the one at the bottom that you've got there, what are the most compelling comments to the hospital management to pay for this comprehensive FCA? You're right. This cost more than a typical facility condition assessment that we came to talk about what was used to being done in the past. We have, you know, this was big conversation with us on this particular project and maybe some others that Josh has done. Couple of things. Have you experienced a lot of times where you either over budgeted for capital, you know, capital improvements, or under budgeted? Could those dollars have been used for increased patient care or increased revenue? And or were you just projecting conservatively so that you didn't miss a budget? Now, a CFO is going to really appreciate that thought, okay, because they're looking at that. Another thing is the management of your asset, right? This is going to help you be more efficient and better for managing your asset from a facility standpoint for all the things that we showed. It's not only just this cost for condition and capital plan, but it's also training. I mean, you're getting to look at things that you may not have looked at in 10 years. So those are some of the reasons for.
Awesome.
There was a question about interfacing, which was maybe that's already answered.
No, I typed, there was one about work orders and PMs, and the short answer is yes, we do have some other capabilities, including work orders and PMs, that can also help feed into that capital plan as well. Happy to kind of take that one offline if you want to reach out to us. Happy to talk through that with you. The other one down there was cost per square foot of the program, AkitaBox field work, assessor field work, management reporting, annual software costs. I'll probably defer that one to happy to have a sidebar conversation. There's so much that goes into pricing these things. And I know, Travis went through a bid process and things like that.
Well, yeah, and I can answer some of the non-software questions about
Sure.
strategy, right? And again, like Josh is saying, I mean, there's so many different parts and pieces to it. So, for example, like in this situation, we knew that we wanted to have an expert in the field for conveying systems, just because this particular, building, they're like, hey, someone's got to look at these elevators. We wanted to look at site because there was potential ADA situations with sidewalk slopes and so on and so forth. Always wanting to look at MEP. On the architectural side of things, that was one of the things where it was a multiple expansion hospital. They're like, hey, we really need someone to take a look at our finishes. Are we old and gray and need to refurbish things? So what we did is we met with the health system. We're like, hey, look, here's what we think you can do here to solve your problem. And they're like, well, we don't know how much that is. And we said, well, let us find out for you and build a customized facility condition assessment based on what you need for this property. We were looking at another one where they just redid the elevators. We don't need to look at elevators, right? And so we got paid, or, we charged hourly to do the work associated with trying to gather proposals in the different disciplines so that we could sit down with the system and say, okay, building envelope could be anywhere from X dollars to Y dollars. And here are the folks that have presented for that. Then you make a decision on the cost of building envelope. Here are the people that we went out to and asked about MEP systems, so that it's almost they're making a decision, based on total. Now I don't know how to, I can project cost per square foot on just one, but they're such customizable. I don't know how to do that. We'll be glad to talk to you about it and figure out what makes sense.
Yep. Yeah. And in terms of annual software costs, it depends on, how much square footage and what volume. It's pennies per square foot, but that can really range depending on what you're really tracking and what value you're getting. The next one down here.
Yeah, I can handle that. So cool. This job, for example, Alexander's saying here, did we capture MEQ and technology and all that? Again, it was a customized thing. We're like, do you need us to look at technology, security, access control, infant abduction? And they're like, no, we're handling all of that. Our IT house is in order, right? On the MEQ side, we said, do you need us to collect for medical equipment? Because there's multiple medical equipment firms that will do that. We do that when we do replacement hospitals all the time. And they said, no, we don't need to do that because we handle medical equipment separately. So on this one, there was not anything on the MEQ side. it would be up to the disconnect going to that full body CT, right, on the electrical side. But when it comes to the equipment, they just elected not to have someone do an assessment of the equipment. Maybe they have just done one previously.
Great. How often is it recommended to refresh the data? That's it depends. You know, you've been in one building, I think, you know, depending on the frequency of change that's happening, you may have some buildings that you don't update that often, other than maybe you do a condition refresh every time you go do a work order on it, because you scan the QR code and update the condition, but you make it part of your process. And so ideally, and the customers that we see that are the most successful have just really taken on almost a cultural shift to this, and knowing that, hey, you know, this thought I've been up here 4 times in the last month. I need to make sure that I update the condition, because they realize that by giving that input at the ground level, it's having a real impact on how priority and spending is being done. And so, you know, it can be everywhere from every time you touch an asset, you update the data, to, you know, you go through once a year and you update 20%, so that every 5 years you get a rolling update. I've seen it done all ways, and it really depends upon, you know, I'd say the critical nature of the facility that you're doing it in. The more critical, the more often. And then, you know, what processes, what people do you have in place currently that this might play in to their workflow, and go from there and make it a best fit for you answer.
Yeah, I mean, you got, if your staff is managing this software correctly, like when there's a renovation, let's upgrade that, let's upload those drawings, let's go ahead and collect some more asset. You know, I've fixed this, I bumped that capital cost up because I've already done it. If they have the interface and manipulation to go ahead and change, that's been done.
Yep.
Then the data has to be refreshed less often, right? I mean, your work, it becomes living and breathing what you do every day. And that's probably the question there at the bottom. I don't know how to interface this with that, Josh.
Yeah, and from an interface with maintenance management systems, it's, you know, the way we talk about it is it's your source of truth. You know, when was the last time you did an audit on your current maintenance management assets? You know, I've never talked to somebody, especially in healthcare, and said, you know, how confident are you that you have 100% of your assets? And most people tell me they're pretty confident they have 60% in their maintenance management system correctly. And most of them tell me that they have data that they're pretty sure doesn't exist in the building anymore. And so, you know, how does it interface? It becomes a source of truth. You can, you know, create the connection. We can pull the data out of your maintenance management system. You can go map it to make sure that it's there. You can add your additional assets, and then push those assets back to your current maintenance management system, just to make sure that you have the right things and the backup, so that you can, you know, have a process to also keep that system up to date as well. You know, we always talk about the fact that, you know, are you getting the most value out of your current systems? In a lot of cases, the answer is no, and not necessarily because your current system is failing you. However, in some cases that is a case, but it's because the data is not the best in your current system. And so you're missing value on a day-to-day basis, simply because the data isn't up to date, or it's not accurate, or you haven't done PMs on something because it was never really loaded into the system. And so nobody does it for years. I see it every day when I talk to clients. And so, you know, those are the ways that it can interact with your maintenance management system, is really by becoming that source of truth. Awesome. I'll give people another 30 seconds here if there's any more questions. Otherwise, we'll give you 5 minutes back in your day and end this a couple minutes early.
But yeah, I mean, feel free to reach out to us if you come up with a question later. I mean, I think there was a question that rolled by about, will this copy of this be available? It's got our contact on it. So,
yep.
Yep. So Josh and Travis, thanks so much for your time today. This was great information. obviously a lot of interest with the questions. Just before we conclude, I just want to remind you that a recording of today's webinar will be available, should receive an email by next Tuesday with a link to the recording, and also include a copy of the slides. And thank you very much for attending today's webinar.
One
There's a
more
question.
Yeah. You want to answer that one, Travis, quick?
Did your HVAC system teams look at HEPA filter and cooling? Yeah. That was part of the condition assessment. Take, for example, those two would be TLC engineering was tasked with the MEP fire protection. And so, yeah, that was in, both in the digital, the software-based data would be cooling tower assessment on August 21st, 21, that you need to clean the muck out of the tray. But also in the published report that they provided, as typical, would be this cooling tower had this, or this filter need to be changed. Yeah.
Yep.
Yes, they looked at all that. Now, one thing I will tell you on this, again, like we met together as a team, what can be inspected, right? For infection control, reasons, the health system elected to, we are not going to assess anything above, acoustical ceiling that's in patient care area, unless we found something downstream in an equipment room or something that made us point to go look at that. It was just an easier, more efficient way to assess without having to put rooms negative just to look above ceilings, but that could be different in a different place. It could be like, okay, yeah, we're going to go above ceiling. This is just medical office building or whatever.
Awesome.
All right.
Cool.
Well, thank you, gentlemen, and thank you, everybody, for staying on and attending today.
Absolutely. Have a great day.
All right.
Have a good Thursday. Go Braves.